My name is Andrea Palladino. I am the Programs and Communications Manager here at HCC. And to get us started, thank you to our sponsors. Well, thank you so much. We'll end our poll and see how what our results were. And looks like more than half of you have had issues with healthcare access either now or in the past. And as far as what people think healthcare access means, we have everyone can get access to the healthcare they need, continued treatment, equal access to diagnosis and treatment, and equal access to care. So equality is very important. And to help us discuss more about that, we are going to continue to our panelists for this evening. And a bit about Hemophilia Council. We're a 501c3 nonprofit formed in 1989 for shared advocacy on behalf of hemophilia organizations in California. And we focus on statewide access, which is the point of today's webinar, as well as education and advocacy for people with bleeding disorders. And if you went to our legislative day recently, last month, you would have seen our advocacy in action. Now some introductions. First of all, we're going to go out of order a bit for a second because I want to introduce Brent Mascoro. He's going to be our lead panelist today, who's doing the who is guiding the discussions. And Brent became a member of the community 14 years ago when he met his wife, Julia. And Julia's father, Bob, had some severe hemophilia. And now Brent and Julia are the parents of two boys, Lawson and Prescott, who both also have severe hemophilia. And Brent's committed to helping other families, especially dads, and advocating for the community. Brent, take it away.
Thanks, Andrea. Incredible honor and humbled to be here tonight and say a few words. This is so incredibly important what HCC does. And as a parent of two young boys with severe hemophilia, one with an inhibitor, we know firsthand how incredibly important it is to have a group fighting for us, advocating for us for access to not only treatment, but to diagnosis, support, counseling, etc. So thanks, Andrea.
Mia, you want to introduce yourself?
Yeah. Hi, everyone. My name is Mia. I'm from Santa Barbara. I have von Willebrand's disease, and I'm also an HCC board member. Currently a college student, and then I work full-time for the Ventura County firefighters as well.
And I'll introduce myself as we go to my introduction there. I am a mom to a young boy who's now 18. I've been in the community for that long. I'm also part of the Hemophilia Council, and I like to advocate for our Hispanic community. So we are going to have this conversation about health access. I'm going to give it back to Brent.
Thanks, Cindy and Mia. Andrea, can we go to the next slide with the first question of the day? What does healthcare access mean to you? So Cindy, you want to kick us off? What are your thoughts on that?
That's a big question. But the basics of health access is being able to get providers to help you when you need help and you're having some health issue.
Yes, totally agree. Mia, what are your thoughts?
Yeah, I think personally it's just being able to live my life the way I want to, do the things that I love, um, and being able to get access to my medication when I need it. Um, and yeah, just do the things that I have fun doing.
Yeah, having a voice in all of this is such a big piece, right? And actually being heard, believing that you're being heard, you know, especially as patients and parents, when you have, you know, firsthand information and knowledge every day, and being able to have those conversations, being able to even get to your providers and have those conversations around what you believe is in the best interest of your family, your kids, patients, etc. And we know that it's not equal. We know that there are many, many barriers. First, just from a diagnosis standpoint, when we talk about rare disease and rare bleeding disorders, we know that the length of the patient journey just to diagnosis is oftentimes way too long. Just to even get a diagnosis on how do we set up a treatment plan, how do we make sure that you're covered in the right way. That's not even talking about insurance, right?
Right.
Cindy, what are some of the things that you've had to go through with your boys who are now, you know, late teens and becoming young men?
It's maintaining access, being a single mom for so long was so hard to keep that balance and the fear of staying on Medi-Cal because that was where we had access to care. But at the same time, if I did too much, they will drop his care, but then I couldn't afford to pay. So it's how do you learn to navigate maintaining coverage for such a demanding condition? Because as a mom, I want the best quality of life. I want the best care. But at the same time, there's always those roadblocks when you're depending on a system that sometimes does not understand that even though you made $50 too much, you take multiple trips to the ER in a month, multiple trips to the treatment center. So it was a hard balance to maintain that access.
Very complicated setup, right? Very complicated system. And then to be dealing with all the stuff that you have to deal with on a day-to-day basis, and then try to understand that, navigate through that, and be your own advocate, you know, it's very, very stressful. Mia, what are some of the things that you've had to go through and your family's had to go through on access or barriers, or if you could share a little bit about that?
Yeah, I think going off of maintaining access, it took a long time for me to get my medication figured out to stop my bleeding. Through middle and high school, I missed a lot of school, sometimes more than half the year, just with different bleeding issues and not being able to stop it at all. So being able to continuously have my hematologist there and open for me, and getting my factor right so I could finally get my routine right and get my body kind of where it needed to be. But it was definitely huge just being able to try different medications and seeing what worked best for me and my body.
And it sounds like you're doing great right now.
Yeah, definitely a lot better once I figured out that routine.
Awesome. Andrea, maybe in the interest of time, the next slide, the next question. Are we going to do questions at the end just so I understand how this, or interaction now? Anytime is cool.
They could put the questions on the chat and we could answer them at the end.
There you go. Okay, perfect. Cindy, you should be leading this like we all know, right?
Okay, someone needs to start practicing.
So Cindy, kick us off again then, since we're talking about that. What are some of the barriers to access? You touched on a little bit, right? And we, knowing you for many, many, many years in the community and knowing your boys, we know there's been a lot of barriers, but maybe you could share just a little bit specifically about what those conversations look like and navigating that looks like.
So that's a good one, especially right now after our, extensions because of COVID, the different way the programs were running. We had some access given to us as telemedication, right? But at the same time, not everybody had the tools to use it. So that it became real interesting how, as a community, we were able to bring the tools for that time period, but at the same time, we're losing some of those benefits, and some of these patients have limitations. So transportation was one of the biggest issues for us as a family. You know, doing 100 miles trips, especially with gas prices. So how do you learn that there's some benefits in your coverage? You know, it took some other one telling me, you get mileage reimbursement. It's a lot of paperwork, but you get mileage reimbursement. But that was one of the biggest barriers, especially there's a time period where we were struggling so much, and not knowing that would have been helpful at that time, that they could have helped us with transportation. They could have given us that reimbursement and not giving us that barrier. How do I figure to drive the 100 miles? I could get there, but am I going to make it back home? You know, and that's, you know, one of the things that's in the community, especially because most of our treatment centers are 100+ miles distance for our community members. So I'm glad that we have transportation funds and transportation access, but how do we get them? It's still a barrier depending on where you are. If you're a managed care, if you're a straight Medi-Cal, if you're just a GHP, how do you access, even though they're there, it's still a barrier for a lot of us. Mia, I'm going to send it to you. I think we lost Brent.
Sounds good. I had to switch hematologists as a teenager after I was sent away from my first one. He was a hematologist and an oncologist in a smaller county clinic, and bleeding was definitely not his focus, especially von Willebrand's disease. And my bleeding wouldn't stop, and access to factors started to become a challenge. So it was just a difficult time for my family all around trying to figure that out. We weren't familiar with HTCs at the time, but we were grateful to find one, and a good one at that. They had a 340B pharmacy, which meant I had access to my medication when I needed it. So I'm definitely grateful for that. But I think getting people to HTCs and education like that, I think HEMOCs are difficult to go to sometimes when their focus is more oncology. Yeah.
Andrea, can you give us the next slide, please? Okay, so I'm going to give it to you, Mia. How do you think individuals can help themselves gain access?
For my family, I think talking to other families and community members was something that really helped us to move forward. Letty Navarez, if you were able to meet her, she was an absolutely amazing person, but her family also had von Willebrand's disease, and she was able to give a lot of advice just on how to navigate this huge medical giant that we have to. So I think hearing other stories is huge, and talking to people is huge about what you're going through, because most likely someone else has done it already. And then also the council is a great resource. You can reach out to Lynn and Andrea at any time at the office. But I think there's definitely a lot of benefits in talking to our community and raising awareness that way to get access to what you need.
I cannot agree anymore with that. Yes, getting involved in the community, even though it's hard, you know, as Hispanics, for us, sharing our difficulties or sharing our medical history is so hard. But I think it's one of the most important things, you know, asking about what you're going through. You know, I'm having this challenge, and I'm going to say a story regarding talking to others. Again, our commute was over 100 miles to go get treatment. So we would have to travel once a month for our port to have it TPA. That was a scheduled appointment every single month. We did that for 6 years until I went to a women's group meeting, and another mom shared us how they got TPA at home. And I was like, that would have been something I would love to do, have TPA done at home, you know, at my convenience. But if I never had put that out there, I would have probably done it for the 13 years he had the port in of having that monthly visit. So I think always advocating, asking questions, they may tell you no once, but maybe you ask the second time, they're like, okay, they're interested in this process or they're interested in having this information. So I think always having that conversation when you're having a challenge with someone in the community or one of our chapters or our big national organizations. Welcome back, Brent. We'll ask you the question. How do you think individuals can help themselves gain access?
Thanks, Cindy. Sorry. Hey, look, everybody, I'm old school. I still write in a journal. I believe in in-person meetings, but Zoom is our life right now. So sorry about the technical difficulties. It all goes back to voice, right? Like having a voice, having the courage to speak up, having the information to be able to advocate for our own selves, right? And we know that as unfortunate as it is to have to spend so much time on calls and researching laws and ways to go and second opinions, ultimately we need to lean on advocacy groups like HCC, like our local regional bleeding disorder chapters, to help us gain that confidence and that information to have a voice. But it's not easy, and a lot of people, like to Cindy's point earlier, don't know about getting reimbursed for gas mileage. And you think about the families that don't have the money to pay for the gas. That means they're not going. That means their access is gone, simply on information that they're not getting, to be able to help them there. So, I always default back to voice, and it's not that simple, but having the voice and then having the groups like HCC and regional chapters, so incredibly important.
Andrea, can you give us the next slide? So how can community organizations like HCC help create or facilitate access? Mia?
Yeah, I think this is another good community member one. Hearing from others on what's needed and the struggles that they're going through is, I think, the best way to go about creating and facilitating access. It'd be good for HCC to get feedback from people and to find out what programs and what access is needed. We definitely want to hear from community members and just to know what they're going through and what they're dealing with and how we can go about helping them and solving the problems.
Brent?
Yeah, I mean, great point, Mia. Like it goes back to voice, right? It goes back to the voice of the patient. It goes back to the voice of the community members. And how is that voice being heard? So HCC and other advocacy and legislative groups, really taking the time, as they are already, but really taking the time to gather that information, and be able to, work that into their strategies and their long-term plans. And then also partnerships, right? Partnerships with HTCs, partnerships with hematologists, as far as, what are patients saying, what are patients reporting, and even our manufacturing and pharmaceutical partners, that have interactions with patients and caregivers and providers on what are they hearing, what are they seeing, how is this patient journey evolving, and where are some of the gaps?
That's right. And I think also, culturally, we don't like to complain. We don't want to say we're having issues at our doctor's office. We're having issues getting our medication. And I think it's important to let, like the council, let our chapters know we're having this challenge because we may not be the only ones having that challenge. And the more voices that join together, the more we know that there's a problem that needs to be fixed for our community. So I think it's always important, if you're having an issue, to always let someone else know, because they may know how to help you with that issue.
Great point, Cindy. Back to voice, right?
Yes.
Goes back to voice again. And this community has had so much progress over the last 8, 10, 12, 20, 30, 40 years, whatever we want to say, right? It's continuously moving in the right direction, but that doesn't mean that it's perfect. There's still a lot of work to be done.
Next slide, please. So this is for the community, for anybody out there. Do you need help? How do you get a hold of the council? We got the email, we got the Facebook page, we got Lynn's number up there. Take a screenshot, reach out to Andrea. Same way you signed up for the webinar, you could reach out to them and say, I need help. I'm having this issue. I've tried to do it on my own, but I'm not being successful. How can you help me? And they'll find a way.
The great thing about the council too is if they can't help you, they will find someone who can. So I think it's best always to reach out if you're not sure who to go to.
So if anybody has questions, they could unmute themselves or they could put them in the chat.
I have a comment on access related to your health insurance. It could be you have private insurance or you're on one of the state plans, CCS, GHPP, or Medi-Cal. And there are some changes that are coming forward. They've happened with GHPP and they're moving forward with some patients with CCS. So if you have problems accessing your specialty care center or your medication, to let somebody know so that we can find out what's happening with these changes that are occurring in some areas of the state. We won't know if we don't hear from people.
Thank you, Stephanie, for that update and for that information, because that is important for us to know. If it's starting to happen in one part of the state, it may be starting somewhere else. Anybody else wants to speak up or send us a question on the chat? Well, I don't see any more questions on the chat. And I don't know if anybody else wants to speak up before we say thank you for joining us and being here. And I always reach out if you need us. Brent, Mia, thank you for being partners tonight with me. And with that, we end our Zoom tonight. Thank you, everybody, for joining us.